Good morning, everyone. Thank you, Pamela, for the introduction. No pressure. I want to welcome those folks who are participating by live stream, and my hope is that we'll be able to have a really good conversation together. As Pamela mentioned, I am Chris Parker. I am co-principal investigator for Bridging for Health, which is an initiative that is sponsored by the Robert Wood Johnson Foundation. And we're really interested in trying to both find, highlight, and catalyze local multi-sectoral collaboratives that are engaged in doing some of this work of innovating. What's the financing mechanisms that might actually make a difference to population health and health equity? I was asked to sit on the planning group, and I thought, hey, I'll just help design the meeting, and then I'll be good. Here I am. So I'm going to do a couple things today, which I'm hoping the roundtable and others will appreciate. As Pamela mentioned, the intent is for this to be highly interactive. I'm hoping that it will be also healthful. So from time to time, I might ask the room to break out in a jog or something. I'm just kidding, don't panic. But generally, so that we have the opportunity to have conversation in a way that broadens our understanding and allows us to kind of practice what it is that we're preaching. One of the things that I oftentimes ask folks to do just before we actually get a meeting started, which has to do with membership. Given where we are as a society, where meanness just seems to be so pervasive, I invite you to turn to folks at your table and just affirm the individuals at your table. Just say something nice. That's a great pair of earrings. Hey, that tie is amazing. For men, it may just be about the ties, but just say something positive to get us started. Okay, that's enough positivity for so early in the morning. All right, thank you so much. And as you recognize in that little exercise, it wasn't that hard. So I want to encourage us as we're having conversations today, just to ensure that we give each other a voice and that all of us have the opportunity to broaden our understanding as we contribute to the effort today. I learned very quickly last evening at dinner that this group probably won't have a problem having conversation. So I'm going to move us on. One of the things we want to do initially as we think about, as Pamela framed it, a little bit of the past, the context of the present, and ultimately as we leave here this afternoon, a little bit about what could be or what might be, is for us to get grounded. And we start out with a poll. I'm going to ask folks to, if you haven't already connected to the internet, the instructions were there, but if you could go to that URL that's listed there, pollev.com/pophealthrt, and I'll say that again, that's uppercase P, poll, uppercase E, lowercase v.com/pophealthrt. And the first question is, what word or phrase best describes the state of financing for population health? And once you're there, you should have the opportunity to be able to type your response in. And we've seen a few of them starting to pop up. The first one's fragmented, dysfunctional. So far, no real positive words yet in the morning. Rare, interesting. interesting was my word in response to rare. Lacking, constrained. There we go. Exciting opportunities for change. Uncoordinated, non-existent. Missing, inadequate. I think you're getting a theme here. Woefully inadequate, just to underscore. Not aligned with expectations. We heard non-existent. New horizon. That's a nice positive spin. Emergent. It feels like we're making a shift here. Poised to unlock great value. I want to be on that ship. Potential. Tricky or lopsided. It's in the shadow of the healthcare financing, which I think we can all confess. Full of possibility and potential. So I'm seeing a theme here that while folks seem to think that it's not what it needs to be, there is probably an opportunity for things to change. So there are a few more grant-dependent, limited, but this piece around full of possibility and potential, looking for direction, is where we probably want to camp out for today. I'm going to encourage you to kind of keep going, lacking data. I think we're able to capture some of this, and so that when we report out, we'll be able to do the regression analysis and know exactly which terms were probably more used than others. But that's not as important as the general thematic, which is it's fragmented, it's dysfunctional, it's not working how it ought to. However, there is a significant potential for us to actually be able to make a difference. Not connected enough to innovation. All right, so I'm going to move us on to the next poll, and I promise you that we won't be polling all morning. What could spark the greatest improvements in financing population health at scale? In your opinion, and you have the option here to select your top 2 choices. And the choices are, you're not sure, longer time horizons, new financing mechanisms, clear benchmarks, better evidence, more consistent equity lens, more political will, better or greater leadership, and more local control. And the polls are open. And this is kind of practice for November 8th or 28th. So it feels like new financing mechanisms and more political will. It's going to be interesting to see how this finally ends up. They seem to be the 2 responses that the majority of folks are camped out. Clear benchmarks for investment and longer time horizons. Yeah. New financing mechanisms, which is funny that we should say that, because that's exactly what this conversation will portend to as we go throughout the day. One final poll before we actually begin in earnest to have the conversation that we're here for today. And this has to do with one of the objectives for the meeting. This is an opportunity to improve what is being described as fiscal fluency, the ability to actually take part in the conversation and beyond with regards to financing. And you're asked to actually rank where you think you are. I have enough fiscal fluency to be a champion. And it's a tight race, and it keeps pulling back. Disagree versus agree. Let's see where it settles eventually. And here comes neutral. Lest you think this is a 2-man race. All right, so it feels like, if you think about it in terms of both, when we add it all up, folks who disagree with this, which would indicate that you're not at capacity with regards to your fiscal fluency, it totals to almost 50% of folks in the room. That's 34% who disagree and 11% who strongly disagree. That makes it 45% there. And that, in terms of agree or strongly agree, that's about a third of the population. So it means that there is some opportunity here today through our sharing, through our conversation, for those who do have excellent fiscal fluency to be seen as perhaps some experts in the room, and for the rest of us who are either neutral or not quite agreeing with that, that we're hopeful that by the end of today that will improve. So I think this is a really nice place to start. As an evaluator from time to time, the opportunity exists for us to do this again at the end, if we are brave, and see just how many folks actually moved from disagreeing to either being neutral or agreeing. All right, thank you for your participation. I hope that was as much fun for you as it was for me. I want to ask at this time for us to gear ourselves up to listen in a way that increases your own understanding and broadens your own scope, and then to have discussion and to be actively engaged in those conversations that will help to broaden the scope of others and allow you to do some trying on to get to that place by this afternoon where you feel that you're a little bit more proficient in your fiscal fluency. So we're going to start out with a little bit of a historical perspective. Clearly, in 30 to 40 minutes, you won't hear everything of what's gone on over the last 2 or 3 decades in this realm, but we'll use some case studies to highlight and start the conversation about what's been happening and where will the shift go, or where will it likely go over the next couple of years. So at this time, I'm going to invite the moderator for this session, which is described in your agendas as Sustainable Finance Structures for Population Health, Historical Patterns and Insights for the Future. Debbie Chang, who is a Senior Vice President of Policy and Prevention at Nemours, who's done a lot of work around integrating population health and healthcare, well known for her work in maternal and child health and policy evaluation. If she would come and introduce the panel and get us rolling. Could you welcome her as she comes, please? Thank you.